Thank you so much, and thank you for this opportunity. It's my tough job to keep you all awake and excitedly engaged during the postprandial dip, so I'll do my very best. We do have exciting things to share with you. Speaker disclosures. Ovarian Cancer Canada has had unrestricted funding from pharmas, as noted here. And I'm hoping that you go away understanding the new strategic direction of our organization and also further understanding the role that we all can play together as advocates for change, for increased research, and improved treatments for women. So Ovarian Cancer Canada turned 20 years old in 2017, and many nonprofits go along for days and years and years and years doing the same things, but after 20 years, a lot had changed in the ovarian cancer landscape. A lot more was known about the disease. Technology was completely different than when we started in 1997. And so it was timely and appropriate that we should take a deep and thoughtful look at everything that we were doing. In partnership with the McConnell Foundation, we did what was called strategic impact and clarity work over 5 months. And the goal of that was to come out with a theory of change that we could look at and say, if we're successful as an organization, this is what we want to be able to hang our hat on in 15 to 20 years, so a long timeline out. And so we thought about what we wanted to do. Well, of course, we wanted to have affected change that saved women's lives. And by affecting change, primarily we mean having worked on advocacy and changing system issues that would help save women's lives. So we looked at everything we were doing, and if it didn't fit under that, we stopped doing it. We really sharpened our pencil. We want to make sure that every donor dollar that we put towards programs is actually going to move towards this theory of change. And we came out with 3 pillars under this theory. First of all, propelling scientific discoveries and research breakthroughs. So we want to increase our own engagement in research funding, but also work with partners and to make sure that across Canada, this is a move forward because research is the only way we ever will overcome this disease. We want to ensure that women with ovarian cancer can thrive. So those who are living with it have the very best possible outcome, live better, longer lives because they've had the best treatment possible. And we want to stop the disease from starting in the first place. So a whole prevention role here. And overall, we want to say that women with ovarian cancer or at risk of the disease will have fuller, better, and longer lives. Well, this was a long horizon for this. We realized we can't measure this next year, so we took it and then we chunked that down to a strategic 3-year plan. And on this 3-year plan, we have 4 pillars. First of all, the research piece, of course, increasing research investments. And again, we want to increase our own investments, but working with the Canadian Consortium of Ovarian Cancer Research, we've actually put together a paper that we're using in our advocacy initiatives with the federal government that outlines the priorities that will change outcomes for women if research is carried out in these areas. Many of you, I know, reviewed the paper, and I thank you for your input. We want to continue to build capacity. We do try to encourage a lot of activities that will increase trainee engagement in the field so that we always have new trainees coming up to stay involved. And working with all of our partners across the country that fund any kind of cancer research to make them aware of the priority needs in ovarian cancer. Under improving care, we're committed to urging governments and drug manufacturers to ensure that patients have the best possible effective treatments available to them. And we want to also make sure that that care spectrum, from diagnosis right through to palliation, there is support along that whole way. So we do see the treatment clinical piece as very important, but as well the psychosocial piece. We want to make sure that women have access to the psychosocial supports that can help alleviate things, like the anxiety of fear of recurrence that we heard earlier. And we want to work on projects that will help us understand better where the gaps are. So this year we will be moving forward, looking at the pan-Canadian standards that was developed with CPAC and GOC, and our own review of priorities for care in a research document across Canada, working with GOC to look at the low-hanging fruit there. It was very interesting to see Dr. Ellett's paper on the wait times. We hope that we'll uncover wait times for ovarian cancer across the country. And from there, we'll be able to see the places where we should be pushing the hardest right now to improve care for women. Prevention piece. This is going to be a slow start for us because we want to focus on the other two, but we are going to get involved in making sure that there is more uptake of preventive action, where gene mutations can increase the risk of ovarian cancer, and I know that we all suspect this field is only going to grow, the knowledge of more and more genes that impact it, that women know the options that they have, and they are well informed to actually take action to change the outcome for themselves and proactively make a choice about their own risk. We also want to support all of these by reaching more people who are affected by ovarian cancer. So that means not just the women living with it, but their families and friends as well. First of all, we want to make sure that we're in touch with women and they have the information we provide that will help them ask the right questions, make sure that they have their surgery by a gynecologist, and know the supports that are available, clinical trials, options, etc., through the whole trajectory of their journey. But we also know, on a very practical side, that people who are touched by this disease understand the deep, deep needs that are not filled yet. They know we need more money for research. They know that we need to be advocates. And those family members and girlfriends and children are the ones who are going to push this agenda forward with us in the next years. So it's very important that we reach and maintain their engagement going forward. So we're thinking about ourselves differently, and I think you would perhaps always think that we have been a supporter at the bottom of the diagram here. We've always been a knowledge translator, helping the lay people understand the latest research outcomes, translating it into their language, and so they can understand what it means to their treatment. You'll see more convening, bringing together people around particular issues that can help change and move policy, health policy forward. Continuing with partnership building, we've been involved with a number of coalitions that overall move on care for people with various things. The Genetic Fairness Coalition, for example, we've worked on having the legislation in place that will mean insurers can't get that genetic knowledge when you are tested. Can Certainty, the movement for oral drugs, particularly in Atlantic Canada and Ontario. So we've always been part of those partnerships and continuing ourselves to build new ones. But if on this slide I'd been smart enough to make some animation, it's the advocator and instigator that would be flashing here the biggest, because that's what you're going to see a lot more of in the next 3 years. We're going to become much stronger advocates, and we look forward to engaging you in that process as well. So if you just had to look at how we're going to prioritize our activity, the research is the piece that's most urgent, and we're going to continue to work on that. So that's at the inverted pyramid, that's at the widest spot. Ongoing working on the care pathway, and prevention we're stepping into that in a bigger way. Again, all of this will mean more engagement with all the people affected by it, and building our own internal organizational capacity to support all of that. This will be a dynamic diagram. So when we get the research up and cooking to where it should be, prevention and pathway may become bigger parts of it. But it's a dynamic, ongoing process of assessment. So now I want to talk to you about getting involved in the advocacy in the short term. So you may all have been aware, and some of you have been on Parliament Hill with us, we are asking the federal government for a further investment of $10 million in ovarian cancer research. For the first time ever, we were invited to make an oral presentation at the pre-budget hearings. And it was very exciting. There was a lot of interest in the presentation. And actually, one of the MPs sitting on the pre-budget standing committee was very involved and very familiar with our organization and made a very passionate speech to his colleagues about our value as a national organization. When the budget recommendations came out, of 92 recommendations, funding for ovarian cancer research was number 3. Tragically, it didn't translate into dollars, but we never expected to get the money in 2018 anyway. We expected it in 2019. And I know the federal government has committed more money to research. We may fit somewhere into NSERC and CIHR. We're still having meetings to see if there's a hidden pocket there for us. But we're looking for that designated $10 million next year, which is an election year. And that's when the government tends to step outside the usual boundaries and make these kinds of promises and commitments. So we're going to continue with that. We have a campaign that we'll be launching in May, World Ovarian Cancer Awareness Day. And you in the fall for September Ovarian Cancer Awareness Month will be getting documents like this in your email. This is Save Women's Life en les deux langues. And what we're looking at is the investment in breast cancer research and prostate cancer research, which have been very significant. Breast cancer, for example, $250 million over 10 years from 2005 to 2015, with a mortality rate of 14%. Compared with $38 million in the same period for ovarian cancer with a mortality rate of 57%. And we're not saying don't spend the money on the other cancer. What we're saying is look at the difference research made, and we want to see that difference too. So we're looking for you to click on our website and send a letter to your MP. You just put in your postal code. It's so easy to do it. You can customize the letter. And we really, the more engagement we have coming up to that budget planning in November, that will make a bigger impact. And they do count the number of people that write about these things. Access to treatment will be another big push, particularly in the next year in Ontario and Atlantic Canada for oral drugs, which I mentioned earlier, and access to gynecologists in Quebec, which is a big issue. They're actually in 2 weeks having a lobby day in Quebec City focused on that, and we'll be speaking with patients and healthcare providers to the government officials in Quebec about that need. So we hope that you'll stay involved. Watch us, watch this space, because we think good things and big changes are coming. Thank you.